Did you know that over 1 billion people are vitamin D deficient? How can something free and invisible affect your health? Vitamin D affects bone strength, blood sugar, and happiness. I'm Dr. E.I. Williams, your guide to understanding this vitamin. A lack of vitamin D can quietly erode your health. This isn't just theory, it's real science, real people. Let's uncover the top 5 dangers of vitamin D deficiency. We begin with what most people already know: bones. But here's what they don't know. Your skeleton isn't static, it's alive. Every 10 years, nearly your entire bone structure is replaced. And vitamin D? It's the master key that lets calcium and phosphorus rebuild those bones. Without it, calcium absorption can drop by up to 40%, leaving your bones brittle and fragile. Not quite long ago, Dr. Michael Holick published a landmark paper in the New England Journal of Medicine, calling vitamin D deficiency one of the most underdiagnosed medical conditions in the world, a major contributor to osteopenia and osteoporosis. I'll never forget a patient I met years ago, a 63-year-old retired teacher. She fractured her wrist simply opening a window. Her vitamin D level was 11 engrams per milliliter, 1/3 of what it should have been. We corrected her deficiency and paired it with light resistance training with recommendation of sunlight exposure. 1 year later, her bone scan showed measurable improvement. That's the silent power of sunlight. Now let's talk about something you might not expect: blood sugar. Inside your pancreas are tiny clusters called beta cells. They produce insulin, the hormone that tells your body what to do with sugar. But here's the catch: those beta cells have vitamin D receptors. When your vitamin D level is low, they don't function properly. The body becomes less sensitive to insulin, and sugar starts building up in the blood. And this observation is supported by science. In a meta-analysis by Pittas AG et al. In New England of Medicine, people with sufficient vitamin D had a 22% lower risk of developing type 2 diabetes. Another study in the British Medical Journal found that maintaining levels above 30 nanograms per milliliter improved insulin sensitivity markers. That's not small change. That reminds me of a middle-aged man I treated, had borderline diabetes and fatigue. His vitamin D was 13 nanogram milliliter, which was extremely low. After sunlight therapy and moderate supplementation of vitamin D, his fasting glucose dropped, his A1C improved, and he said, "Doc, I didn't change much, except I followed your recommendations." Now let's look at vitamin Marvel on heart health. Your heart beats about 100,000 times a day, and it listens to vitamin D. When your levels are low, your arteries stiffen, blood pressure rises, and the heart works harder to push blood through narrow vessels. Dr. Thomas Wang's seminal study in Circulation in 2008 found that people with low vitamin D had nearly double the risk of heart attack. A few years later, the Journal of the American College of Cardiology published similar findings, showing that deficiency in vitamin D is linked to high blood pressure, inflammation, and even sudden cardiac death. Imagine your arteries as gentle rivers. When vitamin D is sufficient, they're flexible and flow easily. But when it's low, they harden like dried clay, increasing pressure with every heartbeat. I once had a 58-year-old patient with mild hypertension. Instead of adding another pill, we optimized his vitamin D through sun exposure and 2,000 IU daily supplementation. 6 months later, his blood pressure improved without medication changes. This incredible recovery tells us that sometimes healing begins not in the pharmacy, but in the morning sun. Vitamin D isn't just for bones and the heart. It's your immune system's hidden ally. It activates something called antimicrobial peptides, microscopic bodyguards that attack viruses and bacteria before they make you sick. Low vitamin D has been linked to higher rates of colds, flu, and even severe COVID-19 outcomes. In a 2022 scientific report study, patients with sufficient vitamin D had better recovery and lower hospitalization rates in COVID-19 infection. I remember an elderly patient who always caught winter colds. Her vitamin D was chronically low at 15 nanograms per milliliter. After normalizing it, she went through the next winter without a single infection. You see, your immune system isn't just luck, it's chemistry. And sunlight is part of that equation. Now we come to the most surprising effect of all: your mood. Inside the human brain, vitamin D receptors are clustered in regions that regulate emotion. These areas also produce serotonin, the neurotransmitter that makes us feel calm, motivated, and balanced. Now, when vitamin D levels drop, serotonin production falls. That's why deficiency has been linked to depression, anxiety, and seasonal affective disorder. I'll never forget one patient, a retired nurse, who described her winter blues as a gray fog that never lifts. Her vitamin D level was 12 nanograms per milliliter. After supplementation and outdoor morning walks, she said, "It feels like the light came back, not just outside, but inside." That's not poetic, that's physiology. Now, here's a question a viewer once asked me. I'm 62, and I walk outside in the sun every day, yet my vitamin D levels are still low. Why is that? Here's the truth. As we age, our skin becomes less efficient at producing vitamin D from sunlight. Our kidneys, which help activate vitamin D, also slow down. On top of that, factors like time of day, latitude, sunscreen, clothing, and diet all affect how much vitamin D you actually make and absorb. Sunlight helps, but it's only one piece of the puzzle. That's why many older adults need to combine safe sun exposure with vitamin D-rich foods or supplements to maintain healthy levels. So, if you're over 60, it's a good idea to check your levels and talk to your doctor about a personalized plan. So, after everything we've uncovered, how do you make sure your vitamin D level is optimal? Let's discuss how to fix it safely and effectively. First, get tested. Ask your doctor for a 25-hydroxy vitamin D blood test. Aim for 30 to 60 nanogram mmol. Be aware that below 20 is deficient. Above 100 can be excessive, so avoid megadoses without medical supervision. Sunlight exposure for 15 to 20 minutes on arms and legs, 3 to 4 times a week, preferably between 10 a.m. and 2 p.m. when the UV index is board 3 is recommended. Watch your diet and include salmon, egg yolks, and vitamin D fortified dairy. Use supplements. D3, cholecalciferol, is more effective than D2, and combine vitamin D3 with magnesium and vitamin K2 for better calcium distribution. Exercise is crucial as weight-bearing movement increases vitamin D receptor activity in muscles and bones. Also, maintain a healthy weight. Vitamin D is fat-soluble and can get trapped in fat tissue. In general, lifestyle integration is key. Simple habits make a huge difference. Take your walk outside, eat breakfast by a sunny window, choose whole foods over ultra-processed ones. These actions support vitamin D activation in the liver and kidneys. And always, consult your healthcare provider before supplementing, especially if you take medications for heart or kidney conditions. Sometimes, small daily habits, like opening your blinds in the morning, can have lifelong effects. Bones, blood sugar, and heart health tell only half the story. In Part 2, we'll reveal how vitamin D supercharges your immune system. Vitamin D influences serotonin, the neurotransmitter that shapes your mood. What have we learned? Vitamin D isn't just about bones, it's about life. It strengthens, stabilizes, protects, and uplifts. If this video helped you, share it with someone who needs the light. Join me in Part 2, where we explore how vitamin D shapes your mental well-being. I'm Dr. E.I. Williams, empowering you with science-backed wisdom. Stay sun-safe, stay curious, and stay healthy.